Your doctor is asked to have a look at this presentation on osteoarthritis at the base of the thumb, at the what we call the carpometacarpal joint. And this is a very frequent form of arthritis occurring in, I suppose, middle age onwards. Arthritis occurs at this site probably because it's such a used joint, and it's a joint that has particular design features. And you can see from just this look at the anatomy that there's a lot of ligaments that constrain the joint, but the joint is very shallow, and so it is prone to injury and prone to a lot of wear over time, and that's what probably happens. Early on, it's probably useful to know that this type of arthritis can lead to the thumb being pulled inwards, because the joint that's down here may not be able to open fully out like that as a consequence of the arthritis, and over time it may just pull in like that. And sometimes when it pulls in like that, you get extension of the joint above it to compensate so that you can get a good grip. The pain and stiffness that are there may last for some time, but often it's transient, and so it may not always be symptomatic. If you have arthritis at that site, it is worthwhile trying to keep that joint open, and you can do that with a simple exercise, the pressing back on the thumb, by putting pressure on your thumb on that bone here to push back this joint, not this joint here, this joint down here. Okay, and that's important. By pressing with your thumb on the pad at the heel of your thumb, as it were, pressing that back, holding for about 10 seconds and just releasing it for about 5 seconds, and then pressing back again. That will probably reduce the rate at which you're going to develop this flexion contracture, or maybe stop it altogether in milder and moderate cases, and so maintain your grip and maintain good hand function. You can, to relieve the pain, use some local gels. The doctor may give you tablets, some doctors will inject it, and that'll give temporary relief. You can put it in warm water and massage it in the morning time to get it loosened up. Doing that, you may maintain the movement, so maintain the function, and over time this type of arthritis often just settles down. If it doesn't, if it persists, if it's very painful, or if it gets very flexed and inward moving like this, then your doctor will probably refer you to either physiotherapy or for orthopedic surgery, and surgery at this site is very successful for most people.